very much for rejoining us, and we told you earlier that we'll be visiting the psychiatric hospital this morning, just to enlighten and educate us on some little things that we don't know, some common things that we believe is just too common and that is affecting our mental health. So we want to talk about the mental health and the society. Most especially, we want to know maybe we have some people that this mental health problem is really affecting more than others. But we're glad having a doctor. Tàbá sọ̀rọ̀ nípa pé mixed grade fẹ́ máa ń mú àwọn tí wọ́n mọ kíní yẹn gangan láti wá sọ̀rọ̀ lé lórí. A fẹ́ sọ̀rọ̀ nípa ìlera wa, ọ̀rọ̀ ìlera la fẹ́ sọ sí ṣùgbọ́n nínú ìlera yẹn, ìlera ọpọlọ wa bó ṣe yẹ kó rí àtàwọn nǹkan kéékèèké tá à ń fojú di tó dẹ̀ jẹ́ wípé kíní yìí ó ń da àwùjọ wa láàmú ó sì ń da ayé wa láàmú. Inú wa dùn lónìí dókítà wa ti wà nílé lọ́dọ̀ wa ń bí a ọjọ́ fomijomi tó rọrọ̀ torí family meeting la fẹ́ ṣe. Dr. Sunday ẹ káàbọ̀ ẹ káàárọ̀.
Ẹ káàárọ̀ mọ̀.
Èèbó ni how are you?
Yeah, I'm fine.
Okay, Káyọ̀dé bóyá ó ní èdè tó fẹ́ fi kí wọn kó má dàbí pé.
Doctor, mo máa kẹ́ òkè tí
Lóka o.
ṣé kí ẹ sàn wá.
Ẹ sàn díẹ̀ díẹ̀.
Bẹ́ẹ̀ ni tí mo rí fíkì tẹ ó ṣẹlẹ̀ ní kọjá.
Bẹ́ẹ̀ni.
Mo káàbọ̀ rẹ̀ tó yìí o.
Ẹ ṣé.
Thank you very much, sir. Dr. SAJO Sunday
Yes.
is going to be our resource person this morning, and I want to ask, when we talk about mental health, what are we really talking about? Profession.
Àwọn tó ń gbọ́ mi, all our viewers out there, let me say good morning to every one of us, and then to my presenters, let me also say thank you for bringing me here, for having me. When we are talking about mental health, tá bá ń sọ̀rọ̀ nípa mental health. Mental health will mean different things to different people. It depends on how we view it. But then, in a very simple way, I would say mental health is not a static condition. We call it, those of us who are in psychiatry or psychiatrists, we call it, it occurs as a spectrum. Spectrum as in, it ranges from one thing, from one point to the other. What do I mean by that one point? That is positive mental health. So it occurs on a continuum. So we cannot really say that somebody is perfectly mentally healthy or somebody is totally mentally sick. So all of us, we fall on that continuum, we occupy a particular position, which means that it can change, from positive to negative. From one side, we have the positive mental health, and then, what I mean by positive mental health? Positive mental health means that that person, is a state of well-being in which an individual is able to fulfill his or her potentials. We all have potentials. Our ability to be able to fulfill that potentials, is a state of health in which an individual is able to cope with, the stresses of life. The person is able to relate well with people without, causing issues. And then the person is able to make contribution to his or her society. So, ẹni tó bá ní good mental health, ènìyàn lè function in the society. A lè relate dáadáa, bó jẹ́ ìyàwó ni a lè relate dáadáa pẹ̀lú ọkọ, a lè dáadáa pẹ̀lú àwọn, a lè relate dáadáa pẹ̀lú àwọn aráàlú. Then, potential tọ́lọ́run fún, a lè fulfill potential. Then, our ability to function in day-to-day life, that person will be able to carry out his activities without any issue.
Even to stress about.
Even if there is stress. But mental illness is the opposite. So, tẹ́bá ẹ jẹ́ kí n gbọ́ nǹkan tẹ́ fẹ́ sọ kí n tó wá sọ nípa mental illness.
When you were talking,
Yes, sir.
you said nearly everybody is in that room.
Yes, but when you go allow occupy a
Are you
position on
saying
that spectrum.
categorically that we all have a challenge in our day-to-day activities or in our mental health? Is it
No, that is not what I mean, sir.
Please, okay.
Chairman, I want to explain the one side,
positive
the
side
one end. Let me talk about the other end. The other end is when someone has a condition, a mental health challenge, mental health, which we call a mental health condition, a health condition. That is characterized by behavioral disturbances in behavior. You know, it comes with psychological manifestations, behavioral manifestations. It affects how the person disturbance and how the person thinks, and how the person feels, and how the person relate with other people.
How the person thinks.
Things, yes. How the person feel. You know, how the person interacts. You know, social interaction. You know, and then it also affects, you know, how the person function in daily life. So when there is a disturbance in any of these areas, in our emotion, in the way we perceive things, in the way we relate with other people, you know, we now say this person has a mental health challenge. Now, coming to your question, I said, you know, when we define health, health is not just a state of absence of disease. You know, so health is viewed as a spectrum, you know, that ranges from one side to the other. So which means is that there is nothing like somebody is perfectly healthy. Nobody is, you say, somebody is mentally sound, or somebody is mentally ill. It's not a binary state of well or ill. So it's like we occupy a position. It's a range, and all of us we occupy
now
a
depends
position.
on where you fall.
So our, you know, things of life, there are some factors that may affect our position on that. So our position can shift at any time, depending on what. For instance, that I'm heading now. If, for instance, God forbid bad thing, if I fail or something happen, maybe probably I'm expecting something, and then that I experience a failed expectation, I may feel sad. Do you get what I'm saying now? But that does not mean the person is mentally sick, because when I say somebody is mentally sick, the person must be able to meet a certain criteria. There are things that we have also explained. So what I mean in church is somebody's position can shift from being positive to negative.
Then how
Okay,
can we
now,
identify who is mentally
what are the
sick?
causes?
Yes, like I said, sir, 4 things will help us. That's 4 things, we call it 4 Ds. That will give us the first thing is deviation. You know, there is a particular behavior that is acceptable to the society, social norms, the way we relate. So if there is a deviation from that, you say, this person is sick. And then you now look at this deviation, is it causing disturbance for that person? Is there dysfunctioning? That's another D. That is second D, dysfunctioning. That is the way the person relates, the function, that the person function at home, as a husband, as a student, as a teacher, you know, as this and this, as a politician. Has there been a disturbance? Is the person still able to carry out his or her normal activities? Then the other D is danger. The behavior of this person, is it posting a risk of harm to others? If my behavior is posting harm to you, then you mean that, like yesterday somebody called me and said somebody is somewhere, he said the person, the behavior is disrupting the whole place. So is it causing to? The other D is danger. Then durations. How long has it, like, you know, like our state of mood is transient. Somebody may be, you know, if somebody experience, you know, a good fortune, the person will be happy. That is mood. If somebody also experience misfortune, the person will be sad. It's not. But if that sadness now persists for a very long time, that is the durations. Or is it also causing distress for that person? Is this causing suffering? Is it causing psychological pain, emotional pain for the person?
That's number 3.
That is the 4th or the 5th D. Yes. So now coming, what are the causes?
Yes.
The causes of, just like I've said, the causes of mental illness, you know, is complex. It varies. It's complex. And our psychiatrists are not putting multifactorial. As in, what I mean by multifactorial is that it involves interaction, you know, among many factors. What are these factors? Genetic factors. The other one we look at our social factors, environmental factors, and then the other one we look at what we call psychological factors. So let's pick the biological factors. All of us who are here are products of our parents. Yes. If I look at you now, if I look at your face, look at the way you look, most likely you resemble your dad or you resemble your mom. So there is what we call gene. There is something that, you know, we inherit, that, you know, we got, or that is transferred to us from our parents. So mental illness runs in family, or mental illness runs in family. So if my parent has mental illness, or if I have a family history of having of mental illness,
My great-grandfather.
my great grandfather, so my risk of having mental illness is high. But that does not mean I will develop mental illness. Are you getting it now? It's just that I have a predisposition. And then the other one we look at is what we call, there are some chemicals in the brain. And those chemicals, we call it neurotransmitters. Yes. Just like the way we pass, messages from one person to the other. These chemicals are the one who convey messages from one brain cell to the other brain cell. And so if the chemical is carrying wrong signal from one cell to the other, then that means the behavior that cell will elicit, will produce, will be abnormal. And all these chemicals abnormal. All these chemicals, they are the one that controls our, how we sleep, our behavior, our emotion, our thought, etc. So we call them brain chemistry. So if there is abnormality of this brain
maybe
chemistry,
you have to face the
yeah. So if there is abnormality of this brain chemistry, we can say, okay, this person has, so it could either be high or low. One of them is serotonin. Another one is dopamine. Another one is glutamate. Another one is adrenaline, they are etc. So when the level is high, the person may have what we call psychosis. That's when the person is aggressive, the person is misbehaving. But when the level is low, in a very layman's term, when the levels are low, the level of some of those chemicals, when they are low, the person may have depression. Then we say somebody is depressed. It means that the level of those chemicals are very
so
low.
they just have to be normal.
They have to be normal.
Kódà kí ni kẹ́míkà yìí ebi kẹ́míkà tá a gbọ́ pé wọ́n pò pọ̀ yàtọ̀ sí.
Ṣé òun ni àbílẹ̀ ìtọ́lọ́run ti dá sọ́dọ̀
Ọlọ́run
wa?
kó kẹ́míkà ò síbẹ̀.
Kẹ́míkà tí Ọlọ́run ṣe tó wà ní ọpọlọ wa ni a máa ń pè àwọn kẹ́míkà yìí ní neurotransmitters. They are chemical messengers, let me put it that way. They are chemical messengers. They carry information from one part of the brain to the other. The other one we also have to look at is our brain. Looking at our brain is a structure. Our ọpọlọ is a structure, and as I call it a structure, it has three components. There is what we call the anatomical structure, that is the physical appearance, that is the anatomical structure. The chemical composition, and then the physiological composition is how the brain, how it works. So the the structure, that is this anatomical composition, the anatomical structure of the brain, if is damaged, so there are so many things. Bóyá ẹni tó l'accident tó forí gbálẹ̀, àbẹ́ni tó ní stroke, tó yẹ pé stroke yẹn affect ọpọlọ ẹni yẹn, àbí ọmọ kékeré tá a ṣẹ̀ṣẹ̀ bí, ṣẹ̀mẹ̀ pé gbà táwọn ọmọ bá wà, ìyẹn is also another thing that lay predisposition, because èèyàn tó develop mental illness, most of them foundation yẹn ti wà lay láti gbà kan ti wà nínú ìyá wọn. And that's why sometimes tá a bá ń sọ̀rọ̀ nípa prevention, sometimes prevention, there's what they call universal prevention, although this is just a deviation. You look at when you improve the condition of the society, in a way you are preventing mental health issues. For example, àbá tó yẹ pé tíṣẹ́ bá wà, ọ̀nà dáa, but all these things reduce, it reduces our stress level. It means that in a way you are reducing the risk of individual of the populace from developing mental health issues. So màá fi yẹn sí apá kan. So ká wá lọ sí nípa ti láti inú. So bóyá obìnrin lóyún, tóbìnrin yẹn bóyá ẹni tó lóyún báyìí who is not eating good food, tí ò jẹun dáadáa. Bóyá somebody ẹni tó lóyún tó jẹ́ pé ó yẹ kó gba vaccine, some of those immunization tó yẹ kó gbà táwọn aláboyún máa ń gbà tí ò gbà. Check òun làwọn dókítà máa sọ pé káwọn obìnrin kó gba vaccine immunization. So if at that point in time, if the person contacts some infection that could have been prevented by taking vaccine, those infections, some of them are viral, majority of them are viral infections. The mother may not know, but those viruses might have gone to destroy the development of the brain of that child. So not eating well. Then the women also take hard drugs when they are pregnant. Cocaine, Indian hemp, alcohol, etc. They don't even see, they see it as just a way of enjoying themselves.
Part of life.
Part of life, unknowing to them that they are affecting
The baby.
brain. And then bàtà bá fẹ́ wá bí ọmọ yẹn náà, a child can have a brain accident at birth, which we call birth aphasia. Maybe there is a prolonged labor. That prolonged labor here now reduces blood supply to the brain. Check out what you call birth aphasia. Or bóyá baby wọ́n fẹ́ ìgbà tán fẹ́ bí ọmọ yẹn wà ó pẹ́ kán tó bí ọ bọ́n ṣe bí àwọn kankan ṣàṣẹlẹ̀ wà stress.
Bóyá alágbẹ̀bí tó gbà náà.
Bóyá nǹkan ṣàṣẹlẹ̀.
Tó fún orí ẹ̀ pa.
But all those things can predispose a child to mental health issues. And then àwọn obìnrin náà tó yẹ kó bá hypertension, our physical condition tí wọn ò tọ́jú wọn dáadáa, like a woman who has diabetes, a woman who has hypertension, etc. All these things can also affect the development of the brain of that child. Or somebody who has, like I talked about, accident. Then what about epilepsy? You know, epilepsy is something that causes subtle damage to the brain. Àwọn tó ní àìsàn tá a máa ń pè ní wárápá. So the more they are having that serious disorder, that convulsion, the more it will cause, the more it's damaging.
That shut down the brain.
So having said that, so then there is what they call, you know, other things, other medical condition, infection. Infection. If somebody has, you know, there is this popular saying, àwọn máa sọ pé wọ́n ní typhoid fever, tó máa ń cause psychosis, tó máa ń pè ní bóyá severe fever. Let me put it that way. Some people call it typhoid psychosis. So anybody who has infection, will it be HIV infection, will it be COVID infection, any infection, viral, bacteria, etc., meningitis, all these things can also affect the brain. We call those disorder organic brain syndrome. It's organic. Check it again. Then even all these medical conditions too, hypertension, diabetes, etc., if they are not properly taken care of, they can also affect the brain. So let's now come to social problems, which is overwhelming, which is around us, which everybody.
No.
Yes.
Like December is coming.
December is coming. You know, there is what we call, you know, most of these social factors, they elicit what we call stress response. For instance, poverty. Poverty, yes. Socioeconomic state of a person. Poverty, unemployment, family dysfunction, you know, every time, you know, domestic violence. Either is the thing is having effect, can affect the mental function of the woman or the husband. It depends on the victim. Even the children, who is also observing it. You know, the early, so all the social factors around us, being a victim of kidnapping, being a victim of armed robbery. Look at a woman, a journalist, who jumped from either third floor or something in Abuja. What that woman experienced was panic attack. You know, it was at that point she could not control herself. Ordinarily, her judgment was impaired. You know, if yes, all of us at one point or the other we encounter dangers. So it means that the mental state of that woman has not been optimal before that time. To the extent that people said that even the armed robber were telling her, don't jump, and yet she jumped. And yet this is someone that on daily basis all of us will see this person as somebody who is normal, who is mentally sound, etc. To let us know that our state of mind can change at any point in time.
Wow, dear viewers, wherever you are watching this program, it's Mixed Grill, and we're talking about our mental health and the society. We're trying to tell us some causes and some things you have to see in someone, and you know that this person. So each one of us, we have a condition, but it's when you are falling to the other side, that is when you are getting it out. Well, we are here with our doctor from Psychiatric Hospital. Explain better.
So, you guys
father was social.
Yes.
Because we have to see, we are
talking about
bringing
this
you
social,
back and back again,
yes,
so that we
when
communicate.
we're talking about this social,
Sorry,
no, you're not deviating. No. We want to narrow it down
some
to
people
the social.
just think this lady is cheating on me.
Yeah.
And then they will go and commit
suicide or attempt suicide.
Or this guy will say, this lady will say, this guy is double dating.
Yeah.
And when you look at it on a normal life, you say,
the person is able to cope.
What is this?
There's nothing wrong with it. It's not a.
Are you saying that they are product of
yes.
sex?
like I talk about social issues, failed relationship, you know, social isolation, discrimination, etc., all these things, social factor generally, any social conditions, either negative or positive, can elicit mental health issues. And now, the other time I said I define mental health, I say it's a state of well-being in which an individual is able to cope with the stress of life. God himself put all these factors, to build us up, to build our resilience. Someone who is mentally sound should be able to bounce back irrespective of challenge or any challenge that person is facing. So if I have a girlfriend and then I feel that my girlfriend is cheating on me, and then, or probably maybe my wife decides today that she wants to leave me, and I mean probably maybe she feel that I'm no longer responsible, and that does not mean I should commit suicide. There are things that I can do, to address the situation by probably making a call to our parents, call our friends, call other people to help me intervene. That shows the state of my mind. I'm able to make a rational decision.
It's okay.
It's okay. You get what I'm saying now? But if my wife decided to say, okay, I'm not like, this woman, no, and then I just decide, okay, I want to kill her, I want to do this, I want to commit suicide. It means that which has happened, it has happened in so many places. In abroad, in Nigeria, we have
seen mental challenge.
Yes, it's a mental challenge. Yes, that decision. It means that the mental state of that person is not stable. That's why I said other time, I said mental health occurred as a continuum, occurred on a continuum. It's a spectrum. You get it? So some people may be in between. They are not at the extreme. They are not at the other. They are not at the two extreme. Probably maybe they are in the middle. There are people who, when you look at their behavior, you know that this behavior is not normal. But you won't categorically say that this person has a mental health issue.
Okay, in a situation where I want to suspect everybody around me is mental, just suspect everybody is aje, me to say.
Yeah, it's one of the symptoms of mental illness. Like I said, mental illness, I said, is a disturbance in how a person feels, how a person thinks. So suspicion is part of our thought. If I have a thought, if I'm thinking that Ishioma is my enemy, then of course I should not talk, I should not interact with her. I should separate myself with her. I should trust her. If she gives me food, even if she's my wife, if she gives me food, I will suspect that she has put something. You get what I'm saying now? And then I want to monitor her. I want to, for instance, if I'm thinking that probably maybe she's not faithful to me as husband, I'll keep on monitoring her. I will be aggressive towards her and necessary. So undue suspicion. In fact, in a complex term, we call it persecutory delusion. That is, the person believes that somebody is after his or her life, whereas in the real sense of it, there is nothing like that.
There are some people.
So when you are unduly suspicious, either you are suspicious of your wife, of anybody, people around you, like I saw someone yesterday. In fact, it's a very common symptom among our patients. To the extent that some people will say, my father is no longer my father. That's why some people, for days, they may be in the house and they may refuse to eat. That's one of the reasons why some people, they go into excessive prayer. Because if I have this feeling, a belief that some people are after my life, and then I have to move from one mountain to the other. So when you see people undo religiosity, people move from one mountain, ask them what is the content of their prayer. Kini nǹkan tí wọ́n ń gbàdúrà sí, you discover that all those precious times spending on the mountain, you should have converted that time to meaningful activities.
Àwọn míì wà bá a ṣe jókòó ìbára.
Bẹ́ẹ̀ni.
Wọn ò lè jókòó tiwa. Wọ́n kàn lọ dá jókòó.
Yeah, it's like social isolation.
I like it like that. And I'm the person that doesn't like to sit down.
I explain. Sherry, there is, I said there is a biopsychosocial. Biopsychosocial. The psychological aspect of it is what we call, all of us, we have some character or characters or features, traits. This thing, we know that from these personality traits are our behavior that have been there for a very long time. We have some people naturally they are quiet, they are reserved. Yeah. Some people naturally they are quiet. But that quietness does not disturb their relationship with other people. that quietness does not significantly affect their functioning in the society. Some people are quiet and yet they still go around their day-to-day activities. They carry out their activities normally. We have some of them as our bosses. We have some of them as our colleagues. Some of them as our junior, senior colleagues. Some of them as our employers, and yet they still function normally. But when it's now at the extreme, or if we say this behavior, someone who is normally quiet, we say that behavior is typical of that particular person. So if there is a deviation, the person now becomes so aggressive now, or probably maybe unduly happy, or socially unduly sociable. The person may have, that's what they call mania. That is the person, the typical behavior of that person, the person is deviating. Do you get what I'm saying now? But if the person is also quiet, if the person is unduly quiet, to the extent that the person does not interact with his wife, if the person is married, he isolates himself from his children, the person gets to the office and he isolates himself from other people, life is one of the functions of life, it involves social interaction. Even God, our maker, interacts with us from time to time. We pray to him. So life is not lived in isolation. So if somebody decides to be living in isolation, the person will have a mental health issue. So at the extreme, it's a mental health issue. So if that undue quietness or coldness or social isolation is not a part of that person's behavior before, it's just a new behavior, it's a sign of mental health.
Okay, in a situation where someone talks too much,
yes.
Any little thing, you just have something you have to say about that thing. Is this also?
Well, the way God created us, our brain is, as small as our brain is, it plays a significant role in how we behave, in how we think, our functioning, cognition, our decision making, our judgment, etc. Everybody should be able to, for instance, now if you pass a signal to me that I should stop, I should be able to control myself. You get it now? That is, I'm able to make a rational judgment of the situation at that point in time. So if we have some people naturally, they talk a lot. Talking too much, the person is garrulous. It could be a sign of mental illness, particularly mania. There are some people who have mania. There are some people who have hypomania. That is, the mania is the severe form. The hypo is the mind form. And so mania is characterized by talking excessively. All the activities of that person is on the high side, while depression is on the low side. So someone who talks too much, it could just be a normal aspect of that person's life. Like I said, I talk about personality. There are some people who talk a lot. To let us know that mental health is not stagnant. It's not static. It varies. You get what I'm saying? But if that trait or if that habit now becomes too much, excessive, you're asking him, doctor, stop now. Doctor, stop. And I keep on saying and saying and saying. The mental health of that person may not be optimal. But that does not mean the person has a diagnosable mental health issue. But that mental health is not optimal. Bẹ́ẹ̀. Yes. Yes. The other time. Okay. Mo máa miss ẹ pẹ̀lú èdè Gẹ̀ẹ́sì àti Yorùbá. Ẹ jẹ́ kí n bẹ̀rẹ̀ by saying there is something what we call stress. And that stress is just the way we react, our normal body response to pressure, to challenges of life. And so pregnancy itself is a stress for a woman. Tóbìnrin bá lóyún, there are some chemicals in the body tí level wọn máa change. The estrogen, you cannot carry pregnancy, I cannot carry pregnancy. There are some hormones, there are some chemicals, our chemicals, yà pé ní chemicals tí Ọlọ́run fi sára àwọn obìnrin tí wọ́n fi lè lóyún tí ò sí lára ọkùnrin. Ṣẹ̀gẹ̀. So àwọn chemicals yẹn changes in their level. Ló máa ń fà ó wà lára nǹkan tó ń fà tó yẹ pé tóbìnrin bá either bóyá ó lóyún, bóyá ó ní mental illness, or bóyá ìgbà tó bímọ ó ní mental illness. Sharing normally thing about lóyún, there is a chemical hormone in the woman, we call it estrogen. That estrogen, it protects against mental health issues. So if àwọn obìnrin tó jẹ́ pé tó bá ní mental illness tó bá lóyún, we psychiatrists we are confident that that point in time they will be protected because that estrogen level is high and so it will be protected except if there are other factors
that causes
the social factors, if the husband is not supportive, if there are issues, if there are maybe coexisting medical condition, hypertension, diabetes, etc. All those ones, but naturally they are protected. Ṣé tí a bá wá bímọ, ṣé tí a bá bímọ náà ẹ jẹ́ kí n explain bẹ̀rẹ̀ dáadáa. Ṣé after giving birth, level àwọn chemicals yẹn á drop because iṣẹ́ tó ní Ọlọ́run fẹ́ kí wọ́n ṣe, wọ́n ti parí iṣẹ́ wọn. Iṣẹ́ ẹni pé wọ́n sustain oyún yẹn ọmọ yẹn tó wà nínú. So when their level drop, tẹ́ni yẹn bá ti wá ní predisposition bóyá ó ní family history, àbáwọn kankan ti ṣẹlẹ̀ nígbà tó ń dàgbà, you know, early life event. Maybe he has gone through trauma, he has been abused, he has been raped, etc. The father figure was not there, the mother figure was not there. All those things has affected the mental health. So when those things drop, the person may have mental health challenge. And that time is also a stressful time for women. As at that time, àwọn obìnrin lè ní infection. Ṣé get bẹ́ẹ̀ bẹ́ẹ̀ àgbà kan fẹ́ bímọ, ṣé mọ àwọn oríṣiríṣi nǹkan wọ́n lè ní infection. So infection yẹn lè fà á. Then the stress of taking care of that baby, waking up at night to breastfeed the baby. All these are simple. And then at that point in time, the mother-in-law, the father-in-law will come. They will still expect the woman to prepare good meal for them. It's also a stressor for that particular woman. And then you also look at the nature of our health system generally. Most of the majority of the women who give birth, they don't have a very good care after giving birth. Some of them, some of them in the hospital. You know, somebody who is giving birth for the first time, you know, the hospital is supposed to wash them maybe for like either 48 hours or 72 hours. Some of them probably maybe because of lack of space. After 24 hours or 12 hours, they mean, I don't feel they discharge them. So all these are conditions. And then people also have other children to the care of the new baby, so all these constitute a stressor for that woman. So when the woman is not able to cope, psychologically, the person will break down. We call it either puerperia psychosis, etc.
Okay.
Depending on the
Today we've been able to open up a lot of things that causes mental health issues. Then we've not talked about drug.
That one is another maybe for
another day.
It's under biological cause. Drug abuse, cannabis, alcohol, heroin, cocaine.
We are expecting you.
You are coming back to discuss that.
So it's one of the.
In a situation where a young, brilliant, vibrant student, you know, that is good, he knows the book, but at the end of the day, just commit suicide because a lecturer failed in one of the courses or any other thing.
Yes, it's also part of the social factor that we mentioned, that we talk about. When somebody experiences misfortune, that misfortune is a stressor. It's a stress. So the thing happens to that person and the person cannot cope with it. No shock absorber. The person does not have enough resilience to cope, enough support. Because you know, some of these children, their parents might have told them probably at home. Toba fail, they don't have enough support. You borrowed money, if you fail, you must not come home. It's different from someone who monitors my son, even if you fail, don't worry. Don't worry, they do support, to do everything. You get what I'm saying now? For instance, when we were in school, he said that you have to pass, you must not fail. Because at home, we know there is no money. If you fail, you won't have parents who will probably transfer you to another university. It doesn't work like that. But if you have a parent who has the money, you fail now, the person can change you from Unimed to Elisade University, from Elisade to either Afe Babalola University. That person, that confidence is there, that even if I fail, there is no threat from my parent. So the person will still be able to cope. And then all these things depends on our state of mind, the person's psychological state, mental health state. So if the mental health state is fragile, most of the people who commit suicide, they have a very fragile mental health issues. Okay. Most likely they have some symptoms, subtle symptoms, that people don't recognize as a signs of mental health issues.
Okay, is it curable, and who are those people that will assist anybody in such position?
Is it someone who has
Can
mental
we
illness,
manage
or someone who is attempting suicide, or someone who has a mental health
Let's
issue
talk-
generally?
mental health issue?
Yes.
Is it manageable? Is it who are those people around because of our time? Because of
Yes, I would say it depends on the cause of the mental illness.
the genesis of the
Depend
mental
on the
illness.
cause, yes. For instance, now if someone has mental health issue as a result of maybe a social factors, if that social factor is addressed, that mental health issues may not recur again. If somebody uses drug, cocaine, and the person develops mental health issue, if that cocaine, the person stops that habit, the person may recover. So it depends. So it's curable, it's also treatable, but the best word is to say it's treatable. The person may have mental health illness, but if the person receiving treatment, the person may experience perfect mental health.
Okay,
Despite the mental
Kairo,
health.
because of our time, can we continue next week, please?
Next week I will be out of Akure.
Okay, the subsequent one.
Maybe upper
Next
next week.
week. So dear viewers, please don't miss this mixed grill, because we'll continue maybe there's now not next week now. The other one we'll be bringing in the psychiatric doctor.
Please
to-
make yourself available.
Available
because this
for us.
topic is
We
interesting.
just have to, and especially for our young ones, and especially for our parents too. I think parents too have a lot to do concerning the younger generations that are coming up. Because in the olden days, even when you face them, you come back home, are you me party? Baba gone in, but àkókò yìí, since if any little thing, these children are off the land.
Even with the societal things you are talking
Even
about.
majority of the
Yes,
parents
sir.
are also disconnected with their children.
Mm.
The only thing they do is to bring money.
Money.
They don't even they support the connection, the social connection, social interaction is not really there.
Okay, sir,
Thank you,
can you
doctor.
just your parting words to the viewers as you go on the show?
Well, my parting word is to let us know that mental health illness is common, it's around us, and then to let us know that it's also treatable. And then to also let us know that the government also, I'm here because the government employed me, the government has mental health facilities where people who have mental health issues can be treated.
Where can you mention it?
Yes, like I work at Neuropsychiatric Specialist Hospital along Odaru, very close beside School of Health Technology. We also have a unit in Unimed, Ondo. We have a unit there. And then FMC or 2, they also have a mental health unit.
So people can come there.
So at least we have 3 centers in 3 mental health facilities.
Depends on where you are.
Thank you very much, sir, Dr. SAJO Sunday, for coming on the show this morning. We will continue. It's going to be a continuous process on this, as I'll keep on discussing this issue. And please don't hide any person that has mental something at home. Take them to the hospital. That's why they are here. Thank you. This is how far we can go on this section. Let's move to the other side.